what's good for the heart will always be good for the prostate. When you talk about signs and symptoms, I would say the first thing that would come to men would probably the irritative symptoms, the frequency, the urgency, the waking up at night. I think what we call the bothersome symptoms. This would be the first sign that probably men, especially if they're 50 or more, would want to see a urologist. As the symptoms progress, you have urinary stream, intermittency, feeling of incomplete voiding, and like. So that would be a little bit more severe than what I mentioned initially. As you know, it's the second leading cause of death among men over 75. When you talk about death, it has significant impact not only in terms of morbidity, mortality, but in terms of cost. Especially in the country has a per capita income, as you know, like third world countries, it will really have a significant impact as far as the health budget is concerned. So, but even in the first world countries, you can find out that even in Singapore, it's a big cost just to pay prostate health screening and treatment for all your patients above 70 or above 60. What's good for the heart will always be good for the prostate. Look at prostate health, it is not only because it is a secondary sexual organ, but it also has some impact in as far as the vascularity is concerned of the pelvic region. To the point that the new data now that we have is when you talk about LUTS or lower urinary tract symptoms that are interrelated with metabolic issues like diabetes, atherosclerosis, a drop in the testosterone levels, and all this vascular compromise which may affect the prostate not only in terms of growth but in terms of its overall health. And so it will also have its own response to the body. More important thing for men to know is that in the event that you have a family history, which is the most important thing, I think whatever prostate health that we try to follow, you're at high risk at least 50%. But generally, I would recommend that men would have, regular prostate checkup, a good sense of well-being, including exercise, good sleep, adequate food, avoid too much of the fatty food, salt, and all these things. So they will have a good effect on your overall general health. We have nowadays is what we call the BRCA1, BRCA2, HRR mutation testing. These are screening techniques that are done on a DNA level to find out among patients who had family history, especially those who are directly descendants, like a grandfather, a father, which increases the risk of having prostate cancer in the family. So these are the conditions that we advise patients to seek regularly an earlier age of consultation, maybe at age 40, if you have any one of these possibilities. So this strongly supports the ability to transmit the disease hereditarily. This is the reason why we suggest these patients do undergo screening. The first thing I would advise is I think you have to get in touch with your friendly urologist. You have to develop a relationship with your urologist as early as maybe age 45. Unless you have a family history of prostate cancer in the family, will go down to age 40. We advise a regular screening to find out your prostate health and to determine what other sexual needs that you may need as men are starting to age. So these are some of the conditions that will probably require you to do and visit your doctor. Similarly to a woman who needs to have her gynecologist check her regularly, and I would advise that you have to visit a friendly urologist and develop a relationship so that he will know your basic and baseline tests that we need, and really develop a term that may be needed in as far as treatment modalities are concerned, in as far as screening are concerned, and other things that may involve prostate health.